Should we go ahead and start? Welcome,
Yes.
everyone. Hope you can hear me okay. Good afternoon if you're on the East Coast, barely. It's 12:03. Good morning, good evening if you're other places around the world. My name is Joe Egger. I am a faculty member here at the Duke Global Health Institute. I'm also the director of our Masters of Science in Global Health program, and it's my really great privilege to have you join us today, and congratulations on being admitted into our MS Global Health program here at Duke. I'm so excited to I'm so excited to have you. One little piece of housekeeping before I get started. We are recording this session. You'll see the little recording icon there. For those of us who couldn't attend today, or also anybody who wants to watch this wonderful session again in the future, it will be posted, the recording will be posted to our admitted students webpage after we're done. In a few minutes, I'm going to ask some DGHI, and by DGHI, if you don't know, that means the Duke Global Health Institute. I'll go back and forth between the name and the acronym. Some DGHI faculty to join me in a conversation to learn a little bit more about our program. But I first wanted to spend a few minutes talking and just giving you some sort of key points that I think are particularly important about our program that I want you to keep in mind as you're making your decisions over the next couple of weeks and months. This is a really exciting and busy time for us at the Duke Global Health Institute. We have both admissions going on, as you know. We are still reviewing some applications. We're also trying to graduate our second-year master's students. So as you probably know, this is a master's thesis requirement graduate program. So our second-year students both have to write a thesis and defend that thesis. And this week marks really the beginning of that push. So we are, all of us, I'm sure, here on the panel involved in reviewing and hearing from our graduate students, and there's already been some excellent presentations this week on their work. Really excited to see the kind of research that they are doing. Our program is a really global program, right? It is truly global health, and hopefully in the next hour, you will appreciate that and see just how unique and exciting a program our Masters of Science of Global Health degree is. I'm sure that many of you are considering other programs, and if you choose to come to Duke, you can expect to have an experience that we think is truly unique and exceptional. So I want to spend a few minutes talking about some of those key points about our program that I think distinguishes us from other programs. The first is our size. So every year we enroll about 35 to 40 students is kind of our average, and that is not an accident, that is by design. So our program is really designed for that size of a cohort. So because it's a 2-year program, we have about 70 to 80 graduate students around DGHI at any given time. So why 35 or 40? Why is that an important size for us? Well, it's not too small and it's not too big, right? So there are plenty of Masters of Global Health programs out there. A lot of them are smaller than that. And we feel like if you're in a program that's too small, that you're not really getting this sort of peer support and peer learning that you get in a cohort of 35 to 40 students. On the other hand, if you're in a larger program, and some of the MPH programs are quite large, for example, we think you're probably not getting quite the individualized care and attention that we are able to give to our students. So that size is really important to us. The second thing is we have deeply committed and experienced faculty who you will hear from, at least a handful of these in a few minutes. Let me just say here that our faculty across the Institute come to Global Health with a really strong and deep intentionality to make health and healthcare more accessible and equitable around the world. Our faculty come to Global Health with a sense of social justice and a desire to help train the next generation of global health leaders like yourselves. Third, diversity is really important to us. So every year when we are doing this admissions process, diversity of that cohort is really key for us. And we define diversity in many different ways, right? It can be geographically, socioeconomically, by gender identification, race, ethnicity, and many other ways. Regardless how we define this diversity, we believe that diversity of perspective and lived experience that you, our students, bring to our program greatly improves the learning and intellectual development of all students in our program. We also believe strongly in allowing you opportunities for cross-cultural experiences. So you may know that it's a 2-year program, and in between your first and your second year, you are strongly encouraged / required to do a field placement. So you will be doing your own research somewhere out in the world, and we truly work all over the world. We believe that this cross-cultural experience is really key to your education. Fifth, DGHI is highly interdisciplinary, right? We are an institute that sits across Duke University. We are not part of one particular school. That means that we draw faculty from a really wide background. And you will hear from some of these today. So psychologists, clinicians, anthropologists, statisticians, epidemiologists. All over Duke, we have people who both teach in our programs and do research. This is unlike a little bit of a school of public health that is in a school, and we feel like it really breeds a very high degree of interdisciplinary learning for our students. As part of this, you will have the opportunity both to take core courses through our institute as part of the curriculum, as well as taking elective courses from essentially all the schools at Duke. And Duke is a truly exceptional university, as you probably know, and offers really a staggering number of opportunities for our students to take advantage of. And finally, we believe in training you to be highly competent research and practitioners of global health. So your learning definitely goes outside of the classroom. I have been at Duke for 11 years now, and I have worked with many, many master's students during this time. And all of these students have published peer-reviewed papers in journals. And this is not unique to me. This is quite common and the norm across the Institute. We expect our students to engage in research and practice out in the world and not just in the classroom. Okay, well, thanks for humoring that. I appreciate it. In a few moments, I'm going to ask our faculty panelists to join us, and they're going to introduce themselves. But first, let me switch over. I'm going to share my screen here and show you a little bit about yourself. While I'm setting that up, I want to encourage all of our admitted students who are on Zoom today to go ahead in the chat and introduce yourself. If you haven't already done that, I'm not very good at tracking chat while I'm talking, so that may have already started. Thank you, Lisa. But if you haven't already introduced yourself through the chat, I would encourage you to do that so we can all learn a little bit more about you. You can share your name and a little bit about who you are or whatever you want us on this call to know. And of course, I do not see. Let me share my desktop. Okay. Can you all see that screen? Okay.
Yep, all good, Joe.
Thank you. Okay, so this is just a little bit of data about you, our admitted students. So you are ambitious. We are a pretty selective program. The average GPA is 3.5, but just to say here that we look at a lot of different factors of your application. We review every application in excruciating detail. A number of us do that. And so we look at a lot of different things, not just your transcripts or your GPA. We have 21 first-generation college students and 22 first-generation graduate students, which is a statistic I'm really particularly proud of. You bring a wide variety of academic and personal perspectives. So we have 50 different undergraduate institutions among our applicants and 32 unique undergraduate majors. So we are really drawing from across many, many different fields. As usual, you are very internationally diverse, and this year is no exception, and is even a little bit higher than it has been in the last few years. So 69% of our applicants are international, with 14 different countries represented. And as usual, this is common in global health and in public and population health. 80% of our applicants are women and 20% are men. And our average age is 24 years old. So we do have some students who come out directly out of their undergraduate program to our graduate program. But usually the majority of our students do have at least a couple of years of work experience after undergrad. So a wonderful, wonderful group in our program this year. Okay, hopefully you are done introducing yourself. So now I'm going to move into a faculty panel discussion. I'm going to try to moderate and ask our faculty panel first to introduce themselves, and then I'm going to ask them some questions. Just to say at this point that if you have questions, and hopefully you do, that's one of the main purposes of this, and we certainly want you to get your questions asked and answered. Please feel free to either put your questions in the chat, and we will get to them after we have the faculty discussion. Or at the end of this, if you would prefer to unmute and ask those questions yourself, you are certainly welcome to do that. So without further ado, I'm going to now turn to our faculty and ask them to introduce themselves and say just a little bit about who they are and what their background is and what role they play at the Institute. And I have a list here which shows me Eric Green is the first on my list. So Eric, would you mind starting us off?
Yeah, sure thing, Joe. Hi, Eric. I am a faculty member whose primary appointment is here at the Institute. I've been here since 2012, in my current role since 2015. I teach the Introduction to Research Designs and Methods, which you take in the fall of your first semester, so we'll get to know each other well through that. I also teach an elective in data science and data visualization that some students take in the spring. And I am father of two. I have two kids who are 9 and 5, and my wife Eve is also a faculty member here at the Institute. Eve.
Thanks, Eric. Liz Turner, you're next.
Hi, everyone. Yeah, so I'm Liz Turner. You can probably hear that I'm from England originally. I've been at Duke, so faculty member here for 12 years. I'm a biostatistician, so I would engage with you a lot like Eric. In the first semester, I teach the introductory biostatistics and epidemiology class. We have a lot of fun in the fall. And it's really catered to all of you, depending whether you've done biostatistics and epi before or not. And I'll say more about that probably a little bit later. I work a lot on evaluating interventions and programs and partner with many other faculty members across the Institute, across Duke. I'm primarily focused on global mental health, malaria, and cardiovascular disease. And that, I think that's probably enough for right. Oh, and actually I'm going to say this multiple times, so we'll say this now. Another role I play at the Institute is to direct what's called the Research Design and Analysis Core, and this is an important group to know about, so I'll say a little more about that soon. I'll post the link to it in the chat as well, and I'll describe more how that can support you when you're at Duke. Over. Yeah, and welcome everyone.
If I can just I appreciate that, Liz. If I could just add a plug for RDAC as well, because I've been involved with RDAC for a long time. I'm really proud of RDAC in general, but in this context is a role in supporting our graduate students. I think that speaks to kind of our size, right? We're right sized to the degree that we have this statistics core that can really work with any of our master's students on their thesis projects if they need additional, quant support. And that is I don't know if it's completely unique to Duke, but is not the norm at other programs. And I think something we're very proud of. Thanks, Liz. All right, Julian, you're next up.
Hi, everyone. I'm Julian Hertz. I'm actually a graduate of this master's degree. I graduated in 2019, and I was taught by pretty much everyone else on this call. After graduating, I stayed on at Duke as faculty. I'm currently an associate professor of global health and emergency medicine. So I do work part-time as a clinician, and my global health work is primarily in Tanzania, where I do implementation science work, focused on trying to improve outcomes for cardiovascular disease in both the general population and in patients with HIV. Thanks for having me.
Thanks so much, Julian. Anjali.
Hello, everyone. Congratulations and welcome. I'm really happy to meet you all on this Zoom today. I am Anjali Palmquist. I am an associate professor of the practice of global health and cultural anthropology. I am trained as a medical anthropologist, and I am also an international board certified lactation consultant. And that is important because it relates to my research on global perinatal, maternal, and child health with a focus on breastfeeding. I teach courses for first years MSGH students. I teach the 700 course, which is the introduction to sort of field work preparation and practice course. So it's a 1-credit course in the fall and spring of the first year. I also teach global health challenges for students who are elsewhere at Duke who are earning a certificate in global health. And I teach 2 elective courses. So in the fall, I will teach global maternal and child health. And in the spring, a qualitative research methods course. My expertise is a community engaged research, community-based participatory research, qualitative research methods. And I've worked in many different places. I work collaboratively on interdisciplinary teams. And I have only been at Duke since last July, so not quite a year yet. But I'm really happy to be a part of this team, and I love our students, and I'm really hopefully looking forward to getting to know all of you better. So yeah, thank you.
Thanks so much, Anjali. And Emily.
Hi, everybody. Good old whatever day, whatever time of day it is, wherever you are. I am an epidemiologist here, faculty member at the School of Medicine in the Department of Emergency Medicine, and then here at the DGHI. I was here at Duke at DGHI in 2016 to 2018, went to another university, and then came back as quick as I could. And I think that is a lot of reasons why I just love the Institute and Duke as a whole. We'll get into that with the questions. My research is on children who need either surgical or cancer care. And so it's morphed into an access to care issue and a poverty one. So I tend to do a lot of work at the policy level, translating, the good epi data that you can get on the ground into policy metrics somehow. I have a 15-year-old daughter and a 12-year-old son, and we just love Durham. So if you come here, there's just great things, great walking trails, great stuff to do here. Thanks.
Awesome. Thanks, Emily. I am also an epidemiologist, and I have a 15-year-old daughter and a 12-year-old son. So Emily and I have a lot in common, in addition to our love of Duke and Durham. All right, thank you so much, everybody. So I'm gonna go down the line here and ask some questions. And Liz, I'm gonna start with you. So get ready. The question to you is, what is your teaching style, and how do you utilize teams in your courses?
Yeah, thanks, Joe. So everyone, you may remember, I mentioned that I teach the biostatistics and epidemiology class in the first semester of the program. So I've been doing that for 10 years. So we have developed what I think has been a really community building approach for the cohort in the way we conduct like the fall semester. So we have the usual kind of lecture time with self-paced reading outside of the classroom, along with some videos that I've prepared to help tackle some of the topics that we cover in class. And so we have kind of sort of a fairly standard sort of battery of tools that we use for some of the teaching. But we do focus, I think, what might be a little different to kind of the traditional way of covering biostatistics and epidemiology. We focus on trying to make as much of the class time be active as is possible. And we do that through teams. So as Joe asked about the team. So what the goal here is to put you in teams at the beginning of the semester. It's entirely not random, which you may be surprised at given I'm a statistician. It's very intentional to form teams that have diversity in background and backgrounds in many senses, including in kind of background knowledge in biostatistics and epidemiology, so that those of you who have not had much exposure to that before will also be partnered and paired with other people who have a lot of exposure, because as you probably have gathered, would be a very diverse incoming class. Now, this is very intentional so that hopefully everybody in the team, by remaining in the same team through the semester, all the teamwork will be done during class. You don't have to organize yourself outside of class. We make that so you have time dedicated to that. You get to know the members of your team. And what we found over the years is that you all really start to lean on each other. So both just in a personal sense, but then you can really have the opportunity to really learn. You know, you probably know that kind of adage around, you know, you need to teach to learn. And so you have that opportunity to help each other during every session really of the fall semester, all scaffolded and supported by the teaching team, including me as the instructor leading the class. Now, the activities are very structured as well. So they're designed so that you would receive immediate feedback in many instances, so that you're not waiting around to get information to know how you're doing and know what your sticking points are. And we do some of that, for example, by you responding to multiple choice questions online and you receiving immediate feedback, us giving feedback during the class session, so that we're trying to make sure nobody can kind of fall behind or fall through the cracks. And the other hope is as well, by working as teams, having this kind of pace continuing and unfolding over the course of the semester, that you kind of just continue to build on what we're learning over the course of the semester. And that even those of you who have a lot of background in biostatistics and or epidemiology, that you're also going to get different perspectives on this and learn some of the material or have different kind of perspectives on the material, so that we can really kind of ensure everybody gets a common language. And ultimately the goal is of the whole fall semester that you become a really discerning consumer of quantitative data, and you can critique study designs, you can ask the right questions, you can partner with biostatisticians in your future work, whether that be in research or practice, and you just become somebody who listens to the news and questions every single statistic that you hear in the news, basically. And that you then have a deep appreciation for quantitative information and how we use that to inform evidence, like the evidence that we then turn into practice and policy as well. So another piece I will highlight too in closing is that we have a lab portion of the class that is you will go to every week as well. And we have that kind of the more theoretical methodological work paired with the lab. And do not fear, we step through that in a very sequential, nicely paced fashion. It's very well supported both by the team of teaching assistants, TAs, plus the lab instructor, who Christine Mark Walter, who is really phenomenal. So I hope, Joe, that's covered the key bits that
That's
you
so
would hope.
great, Liz. Yeah, thank you so
Yeah.
much. And just to sort of reiterate that about teams, it's so important in global health because so much of our work is team-based, right? Because we're so interdisciplinary by nature, we really have to get used to working with people who have different skill sets, expertise, and different perspectives. And so starting out in Liz's class and really learning how to work as a team to solve problems, I think is quite critical to success in global health. Thank you, Liz. Okay, Eric, I'm going to turn to you and ask you a different question, which is, how do you work with students who might need a bit of extra support to master course materials in your course?
Yeah, sure. Thanks, Joe. Well, I mean, there probably aren't too many silver linings of COVID, but one of them was to normalize Zoom as an option for office hours. And so I have a lot of students who now will sign up for office hours because it's a really low bar to commit to it. For me, I use a service that you click on a link, it finds a time in my calendar and your calendar, and we don't have to even negotiate around what time. You just find it, and then I appear at whatever time you tell me to appear. And so for a lot of students, they like the ease of Zoom office hours. Of course, probably the most common time to meet is before or after class. But I would say now more than ever, it's easy to connect with students outside of class on these course questions that maybe people were hesitant to ask before. I also use like a message board feature. It's called Ed in my classes, where students can post. And I let them post anonymously too. Everyone worries that they're going to ask a dumb question. There aren't really any, but people can post anonymously. They have a question following class, and the TA, really anybody from class can answer. And it's kind of a running log of what questions everybody has. So I'll tell you on the first day, if you email me something about class, I'll probably point you to Ed and have you log it there. So lots of ways to get help, I think.
Nice, thanks, Eric. Yeah, just to also say on Zoom, I love seeing students in person, but especially with coding questions. So all of our quant courses are taught in the R programming environment, and R can be a little bit tricky, just like any programming environment can. And if you're on Zoom, it's really easy to share screen and actually go through the code together, which is actually often easier than doing it even in person on two different laptops. So I completely agree. That can be a really nice way to support students over Zoom. Liz, do you have any other thoughts on that particular question? If not, no
Yeah.
worries, but.
Yeah, just briefly, I mean, I have mentioned this, but to kind of point back as well to the TAs, especially for biostatistics and epidemiology, we have 2 TAs, so teaching assistants. And over the years, that's just been a really, really phenomenal resource for first-year students coming, because those TAs are second-year students who took the class this past fall and are really kind of embedded in the second-year cohort. So that also facilitates this building of community and trying to bring down barriers to come and talk with us and ask questions. And like Eric, I have an open door as well, whether it be virtual or my actual door here in my office. And then again, I'll just point back and repost in the chat that we have then this team of individuals, of experts in research methodology, both quantitative and qualitative, that are available here through the research design and analysis core. And this will be particularly useful for research projects, internship papers, to partner with a member of our team if that's appropriate for you. And as Joe mentioned, we think this is fairly unique in this kind of setting for a master's program.
Thanks, Liz. Anjali, I want to turn to you, if you don't mind, and ask you a question. How do you include the perspectives of other faculty and global health experts in your course or courses?
Yeah, I actually am, it's very important to me that the readings, presentations, and content that are integrated into my courses, especially the elective courses that I teach, come from diverse perspectives. So I do sort of a syllabus inventory to make sure that when we're talking about research issues, for example, in Kenya, that we look at research that's written by Kenyan researchers. And so really being intentional about that sort of diversity, that there's also gender diversity and just diversity of different perspectives around particular issues. One of the things I love to do is figure out, I usually have like a a list of topics and sort of issues that are like related to the content that I want to cover in a course, and then being able to invite other Duke faculty, DGHI faculty and researchers to come and present on their research. I also have a wide network of global health scholars and researchers around the world. And with Zoom, it's really great because we can, in fact, tomorrow I'm going to be inviting a colleague of mine who works for the International Committee of the Red Cross, who is going to present on humanitarian health as an example. And so just really, I mean, I think one of the things I love about being at DGHI and at Duke is that I find the faculty here and staff and also postdocs like really generous with their time. I'm really willing to share if they have opportunities to come and speak to our students. I try to create opportunities for that as much as possible.
Thank you. Emily, I'm going to turn to you, ask you a different question. In your view, what are the key strengths of our Masters of Science curriculum or program? You know, it can be outside of the curriculum.
Well, everybody knows I can talk, so I put notes down. So I would keep it to 2 things because there's a lot that I love about the program. I've been a part of a couple of other universities, and so I've had some comparators, you know, of people that just do it a little different. So I think the biggest 2 for me is the summer experience that you guys get. Because in other universities, you might get a week, which is just not the way to do global health in an equitable, I think, way. So the fact that you have that kind of at your fingertips and you can really choose from an incredible array of, you know, of places to go. My students have gone to Somaliland and Burundi and Tanzania, which are all fairly different than one another, but they're kind of things that the student can figure out what they like. So this summer is just unparalleled. If you're looking at other schools, then definitely check out what you're funded to go and do and the support that is given or not. And the other is, I think, the rigor of the classes. You know, when I was in my master's program, we all knew what classes were kind of throwaway courses, right? Where you didn't really have to, it's kind of easy. You won't get that here. And I don't mean that they're hard, scary hard. They're hard in like pushing what is in you and making you the best global health person that you can be. So the rigor that you're going to get in all of the classes is very, very strong. And I would definitely, I wish I would have had some of those classes during my master's.
Thanks, Emily.
Yeah.
Julian, do you have anything to add to that in terms of key strengths of our program, especially given that you are an alum of our program?
I think Emily hit the 2 big ones. Another one for me is really the flexibility of the program. I think, you know, many students, myself included, entered the master's degree with a different path, a different set of goals. And so for me, I love that I was able to choose electives, and there's so many electives available that really suited my needs. So I needed experience in developing mHealth platforms. I needed experience in qualitative research. I needed experience in doing epidemiology and non-communicable disease. And there were electives for each of those for me. And so really allowing the students to tailor what they want their master's degree to look like and the skills they want to leave with, I think is a huge strength. Emily already mentioned the fieldwork experience, but I think really that 2-year relationship you develop with your mentor, where you're really deeply embedded within a program, you learn a lot of other kind of programmatic skills, running a team, data QA, QC, auditing, that really are widely applicable to lots of different kinds of careers after you leave the master's degree. And I think that my friends and classmates, many of them are using those skills now every day in all sorts of different careers, not just global health research per se. I'll stop there.
Yeah, I know. That's great. That's a great additions. Thanks. Anjali, I'm gonna go back to you. What advice do you have for students as they work to refine their goals for the program as it relates to research or internship pathways, right? So this is a question about, as the student is just kind of entering the program and getting interested in their research trajectory, any advice for students as they try to figure out kind of what they want to do?
I think it's really important for students to develop relationships with their faculty mentors, and to, from there, begin to sort of build their network of people, whether it's peers and colleagues, instructors of courses that they want to take. So not being afraid, really, to spend some time talking to faculty whose research or practice is of interest. Duke also, we have these Think Global events where students get a chance to learn about all of the different work that's happening, different kinds of research that's happening, and so encouraging them to like really allow themselves some space to explore what the different pathways are. Many people, many students may come into the program having like a particular idea about what global health is. And so just inviting them to think about broadening that view, because there's room for just so multitudes, so much real diverse work. It's not just about clinical care. It's not just about healthcare delivery. It's about public health, it's about policy, it's about all different kinds of practice, implementing interventions and evaluating them. So I think we have lots of opportunities for students to, like, through different events, guest speakers, and things like that, to learn about the different opportunities. And then I think just having, getting up the courage to visit office hours, to have a Zoom with someone, to read their paper and sort of say, like, let's talk about this research. I also think it's helpful to talk to students who have come before, to sort of learn, like, who are the second year students kind of doing what I want to do, and what is it like to work with, this particular mentor on research. I think students often obviously they have a perspective on the program and what it's like to experience the program that's different from us as faculty. And so I think really taking advantage of their, experience and wisdom is also really important. We also have like an amazing education team. So Lisa, who's here on the call with us, we have actually, staff who have been doing this job, who are just so excellent at really kind of pulling out opportunities, and connecting students with things that really enhance like their talents and their gifts, and sort of like set them on a path for success. And so to really, again, like, we have the resources, and I think sometimes students may be a little nervous, or they're not sure what to say if they go to talk to somebody, but I just to really like make the effort to kind of do that, because there's so much support there to help students really figure out what they want to do, or how to do what it is that they want to do.
Thank you. I totally agree with all those things. Yeah, I want those students who come to the program who really know what they want to do, and they're really gung-ho, I'm going to do this, that's great, and you should do that. But I would encourage students to keep an open mind and really spend that first bit of time, especially in the first year, exploring all these different great opportunities that we have. Okay, I'm looking at the clock, and I want to make sure I get a couple more questions. I'm probably just going to have 2 more questions, and then I want to make sure that we do have a chance to allow the students to ask questions. We can always come back to these if we want to. Eric, can I ask you a question? How do you approach working with the master's students in our program, and what types of things do you work on with your student research assistant following that initial placement or that match with a new student in our program who matches with you?
So my model has always been to involve students in work that I'm doing, rather than a student comes up with a new idea and we just do the student's idea. I feel like I'm a better mentor when it's a project that I'm closely aligned to. So this year, prior to recruiting a student, there's a development organization in Uganda. It's an Italian group that's been there for 30 years. And I reached out to them and said, I'd really like to take a student this year. And we worked together to identify a project that I would mentor them on and some Ugandan students. And so it was just a good fit. But generally finding opportunities for students that I'm going to be with them for the long haul. So I tell students when we match, you know, if you would like a mentor who you're going to check in with every so often and, you know, wave in the hallway, that's not me. Probably going to meet every week, or, you know, we're going to work on it as a collaborative project. But not all mentors are like that. So if it's not your style, there's plenty of folks here who have a different approach.
Awesome, thank you. Let me see, one more question. Emily, can I ask you one more question? And that is, if you work within a larger research team, how do you include students in that team, right? So just so students are aware, right, we're all doing work all the time in our big groups, and when new students come in, we embed them into those teams often. So Emily, to you, how do you include students in your larger research teams?
Yes, I work with a group at DJHI called Gemini, and it is a huge group with a lot of us faculty, postdocs, biostatistician people. So the advantage to having a student, what I've done is they work with me specifically on whatever projects that I'm working on, but then we attend the Gemini meetings or we attend the data science methodology meetings. So to me, the advantage is you get exposed to a lot more than just something that I could offer. And some students have actually said, you know, I would rather do qualitative research that I heard about in one of the meetings instead of quant, which is what I do in EPI. And so with one of the students, we figured out how her thesis fieldwork could do a little bit of both, since that's really her interest. So I think if you don't work within a larger group, definitely go to the Think Globals like Anjali talked about. But you have that weekly if you do work within, you know, kind of a larger group context.
Thanks, Emily. Okay, so I mean, I could ask 100 more questions of our panelists, but I really do want to give a bit of time to our students. So Lisa, can I ask you to help us moderate? Are there any questions from the chat?
I'd be delighted to. There have been a couple of questions that have come in that have talked a little bit about how students in the program get connected to working with you all. And I can go over that in lots of detail, and I encourage the students, the folks who are on this call, to also join the student panels that are coming up because they can talk about their experiences there. But there has also been a question about sort of connecting to postgraduate opportunities and how working with faculty in the program kind of lead to those larger professional relationships. So I might turn that to the group. I can talk about the match process a little bit later if people want.
Okay, sure. Panelists, anybody want to take that? I think the question is, once you graduate, obviously you are looking for your next opportunity, either a job or further training in school. Does anybody want to tackle that one? How do students usually navigate that process? It's a tough one.
Joe, I can go.
Thanks, Joe.
I think this is an essential part of the student-mentor relationship, is not only guiding them through the degree, but also helping them figure out what they're going to do afterwards. And my former mentees have done all sorts of things. And so for some of them, I'm writing them letters of recommendation for medical school. For others of them, they want jobs in policy or in the private sector. Or PhD programs. And so I think through the degree, a part of, I think most of our mentorship style is talking to our mentees about what do they want to do after this degree is over, and how can we help them along that path, and both tailor their project to kind of meet those goals, but also use our connections. There's so many connections at Duke to help them figure out who has contacts in their desired future career to help position them to be maximally competitive. It's been very cool and very rewarding, I think, to see my former mentees go do all sorts of things and to do everything I can to help them get there.
Thanks, Jillian. Anybody else want to add anything? Yeah, I would say so. Again, I'm an epidemiologist, and then maybe like the fourth day of classes this last fall, I had a new student come into my office and be like, I didn't know about epidemiology. I love it. I think I want to do that. That's not why I came here, but I want to do it. And I was like, okay, settle down. It's only the fourth day of school. But right, so but she wanted to come talk and just be like, well, what does that mean? Does that mean I need to keep going to school? Do I go get a job? So, helping to just kind of be here as people are sort of blossoming and thinking about what those interests are and trying to steer them, in the right ways to do that.
So
Lisa,
I
do
want
you
to.
want to tackle the match stuff
I was going to say,
now, or
I
do you
want
want
to, I
save
want to say
that?
two things. I want to say two things while you all are formulating the questions. I know that you have, and you will unmute and ask. Please, feel free to put your hand up. Very quickly, the way that students in the program get connected to these amazing faculty that you have been listening to is through a structured match process very early in your first year in the program, like within the first month. And so you all will be able to access folders of resources and information even this summer about what opportunities we're going to have available. There's a list of opportunities that everybody picks from. There are always more opportunities than students, so you'll have choices in this space. It includes both research and some organizational internship placements. And basically by sort of mid-October, everybody is connected to somebody that they will be working with for the next 2 years that will also be supporting them as they do their summer work. And I'm happy to go into much more detail after some other conversations, but I really am excited for you all to be able to be part of this process with all of these faculty. I'm going to stop. I see another question in the chat. Are there any partnerships with international organizations or NGOs that provide opportunities for students? Yes. Yes, so many. We have some structured internship opportunities with organizations like FHI 360 and RTI and IntraHealth, which are organizations that are based here. We also have opportunities for students to work with international organizations, and I'm going to see if anybody else wants to throw anything in. Anjali, I saw your head nodding a little bit if you wanted to respond to any of those things as well.
No, I mean, yes, we have lots of opportunities, and I think we also have a practice pathway too. So some students will decide to do something that's very research focused and do a fieldwork project that's more focused, but others might choose to do an internship, which is more of a practice-based kind of opportunity. And I think many of those are nested within international NGOs. And I think there is also an opportunity if you already have a relationship with an NGO or you would like to develop one, we can sort of talk about what that looks like so that we might be able to cultivate some new relationships with NGOs to do work that you're interested in doing.
Yeah, just to let folks know on the call who may not know the Raleigh-Durham area very well where we sit, it is really a hub of global health and healthcare in general in the United States. And so there are lots of organizations, universities, NGOs, private sector research opportunities here. It is really one of the best places to be in the United States for global health. Any other chat questions, or should we try to see if anybody's brave enough to actually ask a verbal question? No pressure.
There's one more question in the chat.
Oh,
how does
great.
the program engage with the local community?
Oh, wow. That's a great one. Lisa, I mean, I hate to ask you again, but since that's really
No,
kind of
this
the
is my
local
favorite
expert here.
thing. This is my favorite thing. Getting to talk to y'all is one of my favorite things. So there's multiple levels of how we engage with the community, and I want to just frame this by reminding everybody that being able to be here at DGHI is also being able to be at Duke writ large. And so there are the relationships that we have locally here that allow students to be part of projects that are working with community partners based here in Durham. And that's through both DGHI, and we have something called a Bass Connections initiative here, which is a university-wide collaborative research program that our students routinely join, often in their second year, which is allows them to have more than just the initial experience of research and partnership and work that they would otherwise be doing. Duke itself has an Office of Partnership in Durham with the idea that we are going to be able to engage meaningfully, and we're not going to bombard a community that might not need us with students that are really well-meaning, but are also potentially here for a shorter period of time. So there is both a research and project focus, and there is a community service focus to the ways that we engage. And then there are student-driven initiatives and activities that we encourage you all to be part of that allow you to move deeper into the issues that are important to you and the communities where you would like to be present and where there is room for you to engage. And I'm happy to share links. I'll try and throw some links in. Oh, thank you. Amanda's already ahead of me with the Bass Connections Initiative link. I'll stop here in case any of the other panelists want to talk about anything specifically that they are doing locally.
Yeah, I mean, I work in East Africa primarily, but of course, global health does not necessarily mean you are working somewhere international to the United States. It means we're working really in communities all over the world, including in Durham and in the United States. And so there are both research and sort of practice opportunities to engage in Durham and in the state.
I also earlier threw a link in regards to the question about professional opportunities. The North Carolina Global Health Alliance is a wonderful resource for this community and to get connected to both industry and other learning institutions and other research partnerships. So I encourage people to check that out because they have a lot of activities and they're very excited to have students engage with them.
Thank you, Lisa. Any other questions of our students? Otherwise, I will shift and ask our panelists to answer one more question, but I want to make sure we have students have an opportunity to ask any questions they have. Going once, going twice. Okay. Thank you so much, panelists, again for joining us. I'm gonna end on one more question to you, and I'm going to ask all of you to start to answer. Liz, I don't see you in my queue, but I think you're still there.
I am.
I'm going to start with you. Great. Can you describe what you enjoy most about living in Durham?
Well, many things, but I've got to say the state parks around are really fantastic. So if you enjoy hiking, the seasons here are really kind of well defined and different. And so going out to Eno State Park or other parks around, you can swim outside, hike nearby. It's very easy to get to. I'd say that's one of the highlights for me.
I agree. I'll jump in and say mine is probably that too. In addition to the people, I think the people here are really amazing. But it's like 4 seasons in the weather. Other than maybe August, it starts to get pretty hot. But otherwise, it really does have, as Liz said, these really defined seasons. And we are sort of in the early spring right now, and it's really a beautiful, beautiful time to be here. And we have a lot of clear blue sunny days. So that's a huge plus. Eric, can you go next? What do you enjoy most about Durham?
Well, 2 things. It's National Ravioli Day to those who celebrate. Durham is a bit of a food scene, I would say. There's lots of good options at all the price points, I think. And the sports. We go to a ton of Duke and UNC sporting events, our family does, and the Durham Bulls are here. And I think I saw on the calendar, DGHI has a Durham Bulls night coming up in May, which I'm super excited about. It's minor league baseball, Bull Durham, if you've ever seen the movie. So lots to do for sure.
Julian.
Well, you all stole mine. Just want to Food is a shallow reason, but I love the food
Uh,
scene here. I also think it's a pretty special place in terms of community. It's really like a progressive, diverse community, really interesting people from all over the world. That's also really friendly. Everyone is just nice to each other. It's just a really enjoyable place to live. I was here for medical school, never thought I'd come back. And then similar to Emily, as soon as I left, I found myself missing Durham and came crawling back.
Totally agree. Yeah, it is a very educated community, like kind of scary, you know, the proportion of people with terminal degrees here is it's a very fun intellectual place to be. Anjali.
Yes, yes, the food. And also sort of like the diversity of the community means that there's diversity in like cultural events and music. There's just like a lot of really cool stuff happening. I love the parks. I love that we can go, 3 hours about ish in either direction and be like at the ocean or the mountains with our family. That's lovely. I came to Duke from UNC, and the Duke campus is just beautiful. Especially now it's spring, like everything's blossoming. It's just I just love walking around campus.
Really beautiful.
Yeah.
Yeah.
The weather's good too. I like
Yeah.
the weather's, the spring, like, yeah. There are other places you can go where the weather's not as good.
I've lived in a lot of those places. Emily, we haven't left you with much. Anything to add or to
Ditto
enforce?
to all of that.
Yes.
You don't have to drive forever to go outside and walk. The other thing I would add is you're in a community that the Durham leadership really has an eye towards equity and tackling like food injustice and high rents, so you're going to hear that and kind of be caught up. You can be caught up in that ecosystem. And so I love that. It's like a whole community working towards justice, on top with what Duke's doing.
We're trying.
And the food.
Well, thank you again so much. I really appreciate all of your thoughts and perspectives here today. And thank you, admitted students. Again, congratulations on being admitted to Duke. We really hope to see you here in the fall. I wanted to let you know about, if you don't already know, we have 2 upcoming virtual panels for graduate students. So I think that was brought up at the very beginning of the session. The first one is on March 22nd, and the second is on March 26th. And so that is your opportunity to hear from other students and get their perspectives on all the things we've said. Hopefully they agree with a lot of these positive things. And you can find registration for those events, again, on the Admitted Students webpage. But thank you so much again, and we really look forward to seeing you soon. Take care.
Thank you guys so much.
Jody.
Hi, thank you.